So I've come out to Turkey, to Antalya. I did my research.
How do you do your research when you haven't been there?
A few weeks after her procedure.
And look what happens.
Her implants are totally exposed. And no teeth.
Right.
And a really short arch. The implants are totally exposed. Oh my gosh. I always say if you wouldn't drink the water there, you shouldn't have surgery there. And this is a great example why. Because she clearly got osteomyelitis and soft tissue defects that are ridiculous. I mean, just eroding through her face. So that's a really aggressive strain of bacteria that is just eating up her face at this point. That comes from, not having sterilized instruments. I wouldn't drink the water in Mexico. Why would I have surgery there? What are they sterilizing my instruments with? There's so many unknowns, and that's scary. And what a horrible, horrible outcome. I feel awful for her. I'm Dr. Eric Baker. I'm an oral and maxillofacial surgeon, a physician and dentist. And today I'm going to be reacting to dental tourism horror stories.
These are the posts.
Our gums are all irritated.
Infection.
So red. You just pop them out with their tongue.
A small portion of the painkillers and antibiotics Ginger's been prescribed.
You just keep hitting her with antibiotics. She's got a bag full of pill bottles because they're not actually fixing the problem. They're just masking the problem repeatedly. Oh, you have gum irritation, inflammation. Let's not actually solve the problem. Let's just put antibiotics at it, which will last as long as the antibiotics last, which is, a week. Just rocking all of those implants. Those implants are going to fail for sure. Ultimately, the treatment modality to start with was wrong. She's got a denture that's removable. Plastic, as you can imagine, just leaches bacteria. It's like a sponge. So you've got this wet, dark, warm hole in your mouth that's full of bacteria. And now you put this sponge in there that just soaks up all these bacteria. And then you rest that on your gums. Like, what's going to happen to your gums? They're obviously going to be inflamed repeatedly.
Many people are seeking expensive dental treatments, and what they're doing is to cut the costs, they head to Turkey.
This is the age-old problem. It's like you get what you pay for. There's a lot of cliches around it because it's true. You're going to pay the price at some point. You either pay it in money up front or you pay the price in pain and suffering and infections and bad outcomes. I think it's a reasonable rule of thumb that if you're choosing the cheapest option, there's probably a reason for that. There's probably a reason it's the cheapest option.
I paid for 28 crown teeth as well as root canal treatment. Because it was off season, it was a lot cheaper.
Prices change by the season.
It has left me with facial scars.
She got infected too. Pretty rare to get an infection after dental work. You go to the dentist when you have an infection for that infection to be solved. Well, not sterile technique would be the most likely. Probably is what's happening if these patients that are going to these less regulated areas and having these bad outcomes repeatedly.
Like it's been absolute hell.
Oh, that looks terrible.
They cancelled my transfers back to the airport.
Same story, different patient. The government, love it or hate it. I mean, that's the beauty of the United States government is there's regulation in place and we have a really, really high bar. And that's really, really important. Isn't that who you want working on your body? The one life you get to live, the one body you get. I can't imagine going someplace where you have to call your own government embassy to help you with transport. What recourse do you have? If you're in the United States, you have recourse against someone who has harmed you. You don't have that in Mexico. You don't have that in Turkey.
I went abroad, got all my teeth pulled. I went through pure living hell, health deterioration.
Oh gosh.
Everything happened.
I keep seeing it with these videos. This one shows it again. It's showing these people at home with their implants exposed in their mouth. Where are their teeth? Why are they going home with these like silver implants that are sticking out of their gums in their mouth? I've literally never done that. Send somebody home with that. They also happen to be swollen like a pumpkin. It just seems wrong in so many ways. Typically in the United States, our practices at GPS definitely go home with teeth. You go home with teeth every time. And we try to be incredibly minimally invasive. We got the minimally invasive GPS procedure, my GPS, that keeps things really tight and prevents swelling and a lot of pain and that kind of thing. So it's really important to not only be able to do the procedure, but do it in a very elegant way so that even your quick post-operative experience, your week after surgery is really good. not just your long-term, 10, 20-year outcomes.
Let me tell you guys something about getting your teeth done that nobody else has told you.
So white.
If you get your teeth done in Colombia and you break them here in the US, you know there's no dentist that's going to touch your
That's
teeth
true.
and fix it because of the liability. You have to fly right back to Colombia.
That's true.
Look.
Doctors don't like to touch other doctors' work because they don't know what was done. It can seem like it's really straightforward. It's not. Materials that they may have used somewhere else, that work could be really, really thin, and you touch it and it's like it's breaking all over the place on you, and you don't know what you're getting into. You don't have the records either. I mean, there's just a whole host of reasons that a dentist would not want to touch that situation. 40% of our patients are previous implant failures from some other office. So, in terms of saving money, that doesn't save anybody any money to redo their work that they flew to, in this case, Colombia, to have done. Ultimately, what do you want? Like, you want teeth that you can smile with and be confident with. What gives you that confidence? Well, knowing that it's going to last. Yes, it needs to be beautiful. It needs to be functional. You need to be able to speak well. You need to feel the confidence in your smile today and 30 or 40 years from now. So if you're thinking about having dental work done or dental implants done, please download our dental checklist. It's going to give you the questions that you should be asking to vet your provider so that you know if you're choosing the right person. Really important before you have any dental work done.